Gastrointestinal stimulants. Gastrointestinal stimulant drugs basically aid in gastric motility. So they're also referred to as prokinetic agents. So they are dopamine antagonists. The mechanism of action of this drug class is stimulating peristalsis of the GI tract. The therapeutic effects and indications include nausea and vomiting, which is usually associated with chemotherapy and surgery, as well as delayed gastric emptying and diabetic gastroparesis. Some precautions and side effects include renal impairment. Side effects include sedation, diarrhea, extrapyramidal symptoms. Nursing actions include assessment of the renal function, assessment of the neural function, and safety precautions. Drug examples, so drugs that we need to know for this class is metoclopramide, metoclopramide, or Reglan. This drug again promotes peristalsis and increases gastric emptying. Gastric motility. Peristalsis is the undulating movement of the intestinal tract. So this facilitates movement of the contents through the GI system. So when there's an excessive or increased motility, that can result in diarrhea. When there's a decrease in motility, that can result in constipation. First type of medications that we're going to talk about are laxatives. So generally speaking, right, what are laxatives? Most of you may be familiar with laxatives. So what are the therapeutic effects of laxative? Laxatives soften the stool, they increase stool formation, and it decreases straining. Indications, reasons why we give laxatives include constipation as well as straining. So it's used to decrease constipation and straining, and also sometimes to avoid Valsalva or avoid vasovagal, such as if somebody already has a slowed heart rate or blood pressure, maybe doing the Valsalva or holding their breath while trying to go to the bathroom can cause some complications. So sometimes those kind of patients will be put on these medications. Some precautions and side effects include fluid volume status, right? We need to be conscientious and think about how's their hydration status. What other medications are they taking? Are there any other past medical history, such as other GI disorders, that may be reasons why we should be careful when administering these medications? Also surgery, right? Also fluid loss and hypotension, especially when we're giving this medication, right? We're getting rid of fluids. Sometimes excessively getting rid of fluids and stool can cause an even lower blood pressure. So if they already started with a somewhat of a low blood pressure, we have to be very cautious, or sometimes we may need to hold it, right? Hold the medication. We have to prioritize what's more important right now, being able to go to the bathroom or the low blood pressure that the patient is experiencing. Nursing actions include assessment for therapeutic effects and side effects. Also, the appropriateness of agents, right? Because we've heard some inappropriate reasons why patients would be on these medications. One can be because a patient wants to lose weight. That's definitely not an appropriate use of laxatives. So, laxatives can be classified as bulk forming, emollient, surfactant, stimulant, saline, and hyperosmotic. So let's go over each classification. So the first classification that we're going to talk about is bulk forming. So the mechanism of action of bulk forming laxative is water retaining cellulose, which is a derivative. Sometimes it can be natural or synthetic, and so that increases the water absorption into the intestines, therefore increasing the bulk or total volume of the stool, as well as softening it at the same time. Some side effects or adverse effect of bulk forming laxatives include esophageal obstruction and fecal impaction, right? So sometimes, especially in the presence of an obstruction, and then we're trying to pump this medication to our patient, right? Where is it gonna go, right? Sometimes it can back up because there's nowhere else to go. So it can cause additional obstruction in the esophageal area and fecal impaction. Some examples of drugs in this class include psyllium, or also known as Metamucil. Next laxative class is the emollient or surfactant. The mechanism of action of emollients include softening the stool by increasing water and fat in the intestines, which creates lubrication, therefore facilitating evacuation of the stool. So the side effects or adverse effect from this class of medication include abdominal cramping and diarrhea. Drug examples under this class, it is commonly given in the clinical setting and you will see it a lot and you may even administer it quite frequently, is docusate sodium. So just note that even though this is under the laxative category, this doesn't necessarily cause bulk formation or increased in frequency. This is actually more of a stool softener. It just makes it easier to evacuate. Stimulants, on the other hand, they stimulate the nerves leading to the intestines, therefore increasing peristalsis, so increasing the movement of the contents in the GI tract. So side effects and adverse effects of this drug class include abdominal cramping and possible dependence. So some patients become dependent in using this medication, and sometimes if they stop, they actually have a hard time going to the bathroom again, and most of them will be scared of discontinuing the medication because they are scared that if they stop, that they won't be able to go to the restroom and may sometimes at worst end up being in the hospital. Some examples of this drug include bisacodil or Dulcolax. So saline laxatives, the mechanism of action of this laxative includes increase in osmotic pressure in the small intestine, therefore increasing the water in the stool. So if you're pulling more water, so it pulls more water in the small intestine, therefore there's more water mixed in the stool, which makes it easier to evacuate. Side effects or adverse effect of this medication includes nausea, vomiting, abdominal pain, electrolyte imbalance, and just remember, because of how it works, right, the osmosis part, this is contraindicated with renal disease, right, because of the fast movement of fluids within the system. So examples of drugs under this class, magnesium hydroxide, or also known as milk of magnesia. And this medication actually, if you pour it in a cup, it actually looks like milk. It's white. Anyway, so in addition to that, right, in renal disease, sometimes there's accumulation of electrolytes including potassium and magnesium, and so if you look at the component of this drug, right, it's magnesium hydroxide. So we have to be very careful. We have to monitor our electrolytes, especially if somebody with renal failure or renal disease already has increased magnesium level. Then we don't want to give more of this drug because this will increase that level of magnesium in their bloodstream. Last medication class are the hyperosmotic laxatives. So the mechanism of action of this laxative includes increasing water content in the large intestine and peristalsis. So side effects or adverse effects include nausea, vomiting, and hypovolemia, low water volume, because it increases the water content in the large intestine and increases peristalsis. So then it's pulling all the fluid and it's expediting the movement. So it doesn't give the large intestine enough time to really reabsorb all that water. And so instead it will come out. So it can actually cause hypovolemia or low fluid volume in the body. The examples of drugs under this class include lactulose and polyethylene glycol. And another drug that you have to remember is sorbitol. And just for the purposes of additional information, lactulose in the clinical setting is also used to treat increased levels of ammonia caused by liver failure. So you will see this given a lot on a patient that's not having any GI problems, they're not having any constipation, but they're giving it because of the increased ammonia level. So this medication actually helps excrete ammonia or lowers the ammonia level by pulling it through the digestive tract and basically excreting it through the stool. Now, the polyethylene glycol, or also known as Golightly, this is commonly used as a bowel prep for colonoscopy or bowel cleansing before a colonoscopy is done. And sorbitol, This is also known as a sweetener. You may notice that some food can have sorbitol, and sometimes if they have so much sorbitol, the side effect of that food, if you ingest food high in sorbitol, it can cause you to go to the restroom more frequently, or sometimes it can even cause diarrhea.